it's having the long-term view is more intuitive because most of us don't have a lot of experience with termites. I mean, I don't, but to your point, like, you have no intuition about whether you should have termites or not. But we do have intuition as human beings that if somebody comes up, right, like our parents, and they're like, someone says, oh, don't worry, I don't go see the doctor. I never see the doctor. In fact, I don't go to a doctor ever, or I don't go to a dentist ever. Our first reaction is not, that's fantastic, you must be saving so much money. Our first reaction is probably, no, that's not good. Yeah. You probably, like, dentist is a great example, right? Like, you probably should go to the dentist every now and then. And I think that's when we tie together that human sort of healthcare level, it does make sense, right? When we're like, yeah, of course you want to get ahead of it. But when you tie to the insurance side and you just look at actuarial tables, to your point, you're like, wow, the MLR looks like this. And the last dimension I remember us discussing is, I think in P&C, if you just have a certain period where you don't have break-ins, you don't necessarily get more break-ins later. It's not like the criminals are like, well, I took a vacation, but I better work extra hard next month, to come back. It just goes back to the mean. Whereas in healthcare, because we're biological entities, it eventually comes back. You can't just, it's not just a lower period.
Yeah. It's the oil change in your car. Like, at some point your engine's going to stop working if you never get your oil change, even though you save that $35 or whatever every few months.
That's exactly right. I think that would be a good example for auto, where we're like, yeah, you probably want to pay for the oil changes. Like, like, how often can you oil change before you're underwater versus the person who never changes the oil?
Right.
And you go to total out that car for a collision. So I'm Andrew Toy from Clover Health, and this is the future of insurance.